I feel like some of that elevator music would have been perfect for this situation. I always laughed at it when other people did it, but I see what they mean. Might as well just start now.
Yeah.
All right. Well, welcome everyone. So I'm George, as you can probably see on the screen, and we've got a few other panelists who can introduce themselves now.
Hey guys, I'm Maddie. I'm at MD2 at Uni Melb.
And I'm Nat, and I'm in MD1 at the moment, also at Melbourne.
Yeah, and we're all from Med Mentors as well. And thanks for coming. I'm MD3 at St. Vincent's. So we got a good range of people, which is really good. You can ask questions. And I'm not sure how many of you know that much about the course, but the Melbourne Med, the curriculum has kind of changed fairly significantly over the past few years, ever since I've begun. And even before I began, they sort of already started changing things. So it'll be good to get a perspective of sort of how it's shifted over the last few years, and it's sort of moving in a trajectory that will continue over the next few years as well, as far as I know. So that sort of is what's most relevant for you, everyone who is thinking of applying over the next few years, which is all very exciting. Veronica will be coming in about 20 minutes, and she has some really interesting things to say. So stick around for when she gets here. But yeah, we might as well just jump into it. As we go, we'll talk about sort of our own journeys through medicine. And if you have any questions, just start thinking about them now, because yeah, it's going to be a pretty informal session. And I guess the bulk of the time will be whatever questions you have. So start having to think and either throw them in the chat or just write them down and ask them when we kind of reach there'll be like a dedicated Q&A session. So don't feel like you have to jump in at any random time, but feel free to put them in the chat in the meantime. Who wants to talk about themselves first?
No, just that also, yeah, this is super, yeah, as George said, informal and fluid, and we can just do whatever you guys want to do. So if you have any questions about anything, just, yell out. We can, yeah. Well, I might as well start
you go first.
Yeah, so second year, Melbourne Uni. I'm at Royal Melbourne Clinical School for the next couple of years. But I actually went to Monash for my undergrad. I did biomed at Monash for I was there for maybe 4 years. I started doing a double degree and then realized I wanted to do med. Studied so much for the GAMSAT, it was ridiculous, probably the hardest I've ever worked. So if you've gotten through the GAMSAT, you can absolutely get through med school, I'd say. Yeah, and then started med at Melbourne, and it's been a really, really positive experience. I met so many great people. It's a really steep learning curve. This year especially has been a very steep learning curve. I think MD2 is when you actually start learning within the hospital, which is obviously a very new and scary learning environment, but also, really, really great. Happy to answer any more specific questions, but I'll let one of the others jump in for now if you want.
I'm happy to go next. So I'm MD1, my first year, and I'm at Western Clinical School. So that's mainly Sunshine Hospital, but a little bit at Footscray Hospital as well. And so at the moment, it's heavily based on campus in Parkville. However, we do have in first year placement. So I have been going to the hospital once a month, and I've been going to a GP placement once a fortnight. Like Madison, I did biomed undergrad, but I did it at Melbourne, so I just went straight through the 3 years of biomed. Um, I focused on like anatomy and physiology, and then now I'm doing the MD. And I did see there was a little question about the discovery program. So that's new for this year. So we're kind of the guinea pigs at the moment trialing that. And so far I've done bioethics as my discovery. So that's kind of where I'm at the moment.
Yeah, awesome. So that's actually a really good. That's a really good place to ask questions about when we get to that section, because that's actually very new for me. I haven't. So I'm MD3, and when I was MD1, that didn't exist. And also, really interestingly, Melbourne Uni is sort of one of the few unis that does start placements in first year, and it's fully clinical in second year, whereas a lot of other medical schools in Australia only start proper clinical placements in third year and then do it in fourth year too. So I mean, maybe some of you have already preferenced and are really set on uni Mel, but that's just something to consider as well, whether you want to spend a bit more time in a chill environment and take 2 years to learn a lot of the preclinical stuff and then do your clinical years in the last two, or if you want to be a bit more like fast tracked and do a lot more maybe lectures in first year, although it has reduced a lot since I did my MD1 and then sort of spend 3 years in the hospitals. Anyway, yeah, I'm George, MD3 currently. I went to Monash as well. So I did biomed. I did that for 3 years. I kind of wasn't super sure what I wanted to do. Sort of half of that. I definitely wasn't set on medicine. I picked biomed because like people say don't do this, but I did. It's because my friends did biomed and I was like, that sounds all right. And so I did it too. It was kind of halfway through, I realized I really liked the idea of medicine. And yeah, I studied for the GAMSAT. I sat the GAMSAT twice. So for those of you who have sat it or are still needing to sit it, don't be discouraged. It's usually something you need to sit multiple times. And if there's any questions regarding that, yeah, feel free to have a think and put them in later. But yeah, then medical school. So MD1 for me was in 2020, which was the COVID year, which was all online. MD1 is like, if I had to pick a year, which that's the best, MD1 would probably be it, because a lot of it was just lectures for us. So luckily, unlike the other years, we didn't really miss out much on clinical placements. We were meant to do what Natalie just described in MD1. We were actually the first year that was meant to do like 1 day of placement every week or every fortnight or whatever. So we'd be assigned a GP or we'd go to our main hospital. But unfortunately, that was scrapped for our year. So I'm glad to hear that they're still doing that now for the future years. But yeah, I'm in MD3 now. I'm at St. Vincent's. Yeah, MD2 and MD3 have been really tricky. I found MD3 the hardest right now. I've heard others say it continuously gets easier, and I disagree with that, but I guess it's very subjective. But yeah, really enjoying it. It has its ups and downs. So if anyone has any specific questions, like I'm on mental health rotation right now, and I've been exposed, I guess, and I have a bit more experience, talked to a lot of friends too about like the burnout side of medicine and I guess the not so attractive side of things, because it's an amazing course. And I'm sure lots of you know Grey's Anatomy and like, you know, sort of the Instagram stuff that you see all looks really positive and shiny, but it isn't always like that. And yeah, I guess if anyone has a few more questions about lifestyle balance and the realities of medicine, and I don't speak for everyone, obviously, yeah, chuck those questions in, because those are, you know, pretty relevant, especially nowadays. And will become even more relevant after medical school, because medical school is just the first step into, you know, continuous assessments and even harder challenges. But it's rewarding. I hope I'm not scaring anyone. Yeah.
There's also just a question here about, there's a few really good questions. I don't know if I can speak to this one about doing research. And I'm pretty sure, George, you can probably speak to this, because MD3 is when you actually start to do your like research project as a part of the degree. But I would say that there is a lot of room to devote, you know, your time to research. I mean, it's like anything, right? Like you've just got a limited amount of time. So if research is something that, you know, you really enjoy doing, there's definitely room to do that. I mean, I've started doing a little bit this year, just like a tiny bit on the side, a few hours a week or whatever. Like if you can make that work, then it's, you know, absolutely fine. But yeah, I think in MD3, I'll get George to talk about it a bit more, but they do, like, you do your own research project, and that becomes like quite a big bulk of, yeah, your studies and stuff. So all in all, there really is a lot of support for research. Is obviously a very important part of medicine.
I will just say on that quickly is that there is increased flexibility now with the course redesign. So there is the option to do the classic research project that I think George will talk about if you want to. But for some people who aren't super interested in it, you can do just a minimum core research stream, which just involves how to read and search the literature and the basics like that. Or if you are really interested, you can do an MD PhD combined pathway. And the uni will help you do a PhD and extend the MD program as well. So there is increasing flexibility with that as well. Sorry, George.
True. That sounds really cool.
Yeah, no, I literally was about to mention that. I got an email. We got sent an email like 2 days ago about this MD PhD, and I'd never heard of it. So there you go. There is an MD PhD. There's also a Masters of Public Health that you can do between 3rd and 4th year. What I didn't know back before I started med is that it's selection based. It's not sort of just open to everyone. It is a fairly, well, I won't say that. I think it's competitive. I know a few of my friends have sort of expressed interest. I don't know how many of them actually got in. But those are sort of the two main avenues to do research. Just reading the question that I can't remember who said it, who asked the question. Lindsay. Yeah, just in terms of research outside of like what's in the curriculum, though, I think that's more what you might be asking. If it's not, I'll just sort of touch on it anyway. So correct me if I'm wrong, Maddie and Natalie. I'm not sure if you know, but I think most med students don't do research outside the course because it is a pretty heavy course as it is, and others, some people are working, you know, trying to make money. They might be living by themselves and have their own commitments. I am actually doing a bit of research outside of the course, but it kind of happened by accident. I didn't actively search it. And I'm not sure if the reason you're asking, if you're more asking for, you know, like once you've finished your degree and you're looking for internship applications, or even further, like if you're applying for residency or registrar positions when you're sort of a doctor and you want to apply to like a surgical program, because there are definitely programs that look favorably on recent research, like sort of emphasis on recent. Like if you've done, like if you had your name on an audit like 8 years ago, they're not really going to care as much. Like still good, but
I do think though, I think just in general, I think that's true. I do think that there is a fair amount of people that do a little bit of research, especially like, you know, in MD2 and then maybe going through MD3 and 4. As you said, like a lot of the time you sort of just fall into it or something. But I also would just really stress that, you know, getting into med and doing med is big enough, and don't feel like you need to go and like do all of this extra stuff to keep up, because I think that's something that I still struggle with. And I think that that's something that you just struggle with, you'd still struggle with as a doctor, but it's just trying to figure out what works for you. So don't feel like, you know, you're studying really hard to get into med and then you get in and then you're like, oh, I need to go and look for all these research opportunities. Like really just, it's fine. If you love research, do it. But don't feel like you have to do anything, you know, for that reason, I would say for now. I might just answer a couple more of these questions because they're all really lovely. What made you guys choose Melbourne over other schools? I live in Melbourne, so my family are here, so it was a big thing. I know people always said that to me before I got in. They always said, oh, you know, location's really important. And I was sort of like, oh yeah, whatever. Like, you know, I'd love to like move to Brisbane and like do something fun. And it's like, yeah, that's lovely. And like, you know, if that's what you have to do, you have to do it. But like, I love my friends here. I wanted to stay here. I got in at Monash as well. So, you know, that was an option, but that was Monash is a little bit more rural sort of setup. So for me, it was just about where my family and friends were, but not for any other reason. I think that all the med schools are good. I really just think you come out with the same thing. You just end up in a sort of a different part of the country, I guess. I don't know what the others think about that.
I agree with all of that. I mainly chose Melbourne Uni because it was most sort of feasible where I was living and where I wanted to be living. And I think the other thing I sort of looked at was just the hospitals that Melbourne Uni's affiliated with,
Yeah, that's
because different unis have different hospitals. Like Monash obviously has Monash, and they have a bunch of others that I think the Alfred as well. Whereas Melbourne Uni sort of has Austin, St. V's, RMH, and some others. So that's something else to consider, because you'll be placed at one of those hospitals, or you'll rotate around too, but just good to have a look at which hospitals you might be interested in actually being placed at.
Similarly, in line with that, something that really appealed to me was the fact that the main campus and therefore all of the affiliations are in like the Parkville hub. So there's the Doherty, Peter Mac, Weehigh, all these kind of medical research places, as well as the hospitals right across the road, like St. V's and RMH. So, as well as for me being close to where I already was, it was where I did my undergrad. Just being in kind of that central location with those connections to all those institutions was appealing. Yeah.
Okay, what else is there? There's a few questions here about the GAMSAT, which I'm super happy to speak to. I don't know if any of the others want to speak to this, but the GAMSAT was probably the most traumatic. I reckon it's the most traumatic experience of my life. Like I did it 3 times, but the third time I worked day in, day out for 6 months, like not even joking. And then I started working for it, and then I was getting really good at it, all the prep. And then it got cancelled and moved because of COVID. Anyway, it was an absolute nightmare, but I'm going to go through that. A few people asking about sort of how I approached studying for it. I actually did the Fraser's program, which is a whole thing in and of itself. I'm not really going to, I won't speak to that, but I really did. I think with the GAMSAT, it is really important to go back to first principles with your study. For example, before, when I first started, I just needed to actually go back and revise all of the principles of physics and chemistry from back in year 12, because that stuff just sets you up, for example, for the science questions. I think there's a real temptation with the GAMSAT to try and just cut corners a bit, which it works for people, but I don't know, I really did it sort of in a stepwise approach. I used a lot of frameworks for my essays and all that sort of stuff, and did a lot of practice questions through the Fraser's program, and a lot of mock exams as well. But I can understand that not everyone wants to do these big programs, so that's so fair enough. But yeah, I think practice makes perfect, and also just going back and understanding the first principles is really important. And as George said, trying not to easier said than done, but I attached a lot of emotional weight on it, and I sort of it was a sort of very anxiety inducing thing. And I think it is important to realize that most people do the GAMSAT multiple times, and also you'll have areas of it where you feel stronger in, and definitely try and play into those strengths as well. I'm trying to think of really what else to say. I think it is really hard studying for it through uni. I did it sort of through uni, but then over summer it was very much a 3-month period, December, January and February, where I did the bulk of my work for it, because I think it's hard to do both at the same time. People definitely do it, but if you have any more specific questions, please let me know. But yeah, once you get through the GAMSAT, I still literally believe that the GAMSAT is the most stressed I've been. Getting into med is not as stressful. Once you're in med, it's not as stressful.
I agree with all that. I think just to add, think long and hard about whether you want to do an interview program a GAMSAT program. For some of my friends, and Maddie as well, it really, really helped them. But for a lot of other people I know, it didn't.
Yeah.
So
important. Yeah.
Yeah, I guess, I personally didn't use one, but I think the main message is really think about what you want to do, how you learn, how you want to sort of go into the exam. Do you want to be as prepared as possible? you know, have looked at everything you could have, or do you think maybe doing a course is going to psych you out, for example?
That's
Like,
very true.
yeah, like
Very
have a
full
really,
on.
yeah, have a good think about it and make up your own mind. Don't just like follow what everyone else is doing, because it works for some and doesn't for others. So really have a think.
Yeah.
Um,
One of the things I think that is good about the program, or just in general, is that it gives you really good structure to your study, because I feel like the GAMSAT is just huge. Like, how do you even, that was one of the biggest things for me, like trying to structure my study. If anyone, I mean, like, I don't know how you did it, George, but yeah.
Yeah, I practice with friends a lot. Like, had I done the phrases course, maybe I would have done better than I did. But yeah, structure is one big thing. I guess it depends on what your strengths are. Like, I really enjoyed the essay section, for example, and really didn't like sections 1 and 3. I guess, yeah, I personally just really like writing. So I think, like, Maddie, did you like structure was something that helped a lot with section 2? Is that kind of how phrases approach section 2? They're like,
Yeah, they do a lot of framework stuff, but I more mean just the structure, like structuring your study, because it would be like, okay, for the first few weeks, I'm just going to focus on, like, you know, learning the first principles of like chemistry and physics, for example, like what I was saying. And then after that, we'll start doing questions. And then after that, we'll start doing the actual exam. And it was sort of this stepwise like thing that meant that, you know, you had smaller goals to work towards, which I guess is something that you can absolutely like do on your own or with friends or with a private tutor or whatever. And I'm more than happy to talk to people about that if they need. Yeah, I do think that's a big thing.
Something that might help with that structure as well is to get kind of external help. For example, if you do have a med mentor, you can talk to them and say, what dates do you recommend I start doing practice exams? Because personally, when I impose a structure on myself, like, I know who made the study plan, right? And I know that they're not going to tell me off because it's just me, right? But if you hear it from someone external, say it's your friends and you make a study plan together, or if it is a recommendation from a med mentor, then it is a lot easier to kind of have those long-term goals to follow, which is definitely one of the big positives of a course like Phrases. But the reality is that, yeah, not everyone needs them and not everyone can afford them. So a lot of the benefits you can get just from getting some kind of external framework.
Yeah, I so agree with that.
I might touch quickly on the Discovery program because I believe I'm the only person who has some experience with that. So for people who don't know, the Discovery program is a brand new thing brought in by Melbourne Uni, where you get a little bit of flexibility with the degree in terms of choosing some subjects. So I mentioned before that I was doing bioethics. For people who might be familiar with the breadth principle at Melbourne Uni, where you do one subject that's from outside your course, it's kind of similar to that. The idea is that you can take some time during all 4 years to explore something that you might be interested in, like a subspecialty or something to do with public health, research, education, and yeah, get some exposure with that. So it's not all year. The subjects, depending on which subject you choose, can be just first semester, the middle of the year, second semester, and you have the option either to change what discovery subject you do every year, or you can follow the same one through all the way. There's still a lot of tweaking at the moment to make sure that the subjects are perfect. At the moment, to be honest, I think a lot of people's experiences depend on which discovery subject they choose. I really loved my bioethics subject. It was from the Masters of Public Health, and so I went and did it with some MPH students. But for some people, for example, they were doing space medicine and they felt that it wasn't really as engaging. So I think it's really useful just to use the Discovery program as a way to explore things you are actually interested in rather than something that you think is going to be easy, because first year and likelihood is second, third, and fourth year are pass fail. So you don't need to worry about getting an H1 or an HD and everything. You do actually have the opportunity to use your Discovery program to explore things that you think you might be interested in. So if you do end up doing the MD at Melbourne, I would definitely recommend that. But I'm really loving it. I think it's a really great opportunity to explore some more things. Hopefully that answers your question, Lindsay.
That's really cool. I wish we had that. That sounds really holistic, I guess.
Yeah, it's really nice.
Any other questions specifically? Otherwise, we can just keep going down the list.
Yeah, I reckon let's keep going down. Atmosphere, we've done. GAMSAT, we've done. Things we wish we knew before we started medicine. I wish I knew that there was less pressure in medicine to exceed super well compared to undergrad. It was really a mindset shift from having to be getting top grades all the time, to be competitive and stressing myself out all the time, to actually getting in. And at least at Melbourne Uni, they really do have the mindset of once you're in, they'll do what they can to help you and nurture you all the way through. So I wish that kind of going into my first semester, I didn't stress myself out so much to get the best marks I could, and rather took it as an opportunity to learn from every patient, learn from every lecture, learn from all the other people in my degree. Yeah.
I'm happy to go next. Yeah, I don't know. I think for me, just I wish I could have reminded myself more that this is just a job at the end of the day. Medical school as well as what comes after it. It's all very important, but you know, really focus on your life outside of medicine. I know there are a few questions asking if that's possible, and it totally is, and it should be an emphasis because you know medicine's great and all, but you know at the end of the day, it is just a job, and you'll have crap days in medicine. You'll have crap days as being a doctor, and you need to be able to go home to something else. So I think that's something I wish I knew, and it's something I'm still working on, I think.
Yeah, I so feel that. This year for me, I think because last year with COVID or whatever, this year I have been like the most social version of myself, like going out all the time, still managing to do uni, like having a really good balance. I do think part of that is the whole pass fail thing. It makes things very, it really is just about like meeting the standard that makes you a safe and capable medical student / doctor. And I think everything that George says is very relevant. I think as well, being in the hospital, you realize like you actually just really don't know anything. And there are just these just doctors that are training for years and years and years and years, and you're just like at the very, very, very beginning. So no one's really expecting too much of you. You really are just there to like, learn as much as you can. Yeah, I think that's definitely something I would have liked to have known. The whole pass fail thing is really, it's a really, really nice, as Natalie was saying, a nice shift in focus, definitely.
Yeah, I would be so stressed right now if it wasn't pass fail. I can tell you that. I am stressed, but I would be way more stressed.
I think for I don't know if she wants to say. Yeah.
Sorry, I thought I'd jump in. I'm a little bit late, but I'm one of the third-year medical students studying at Uni Melb as well. My name's Veronica. Just to that question, echoing everything that you guys have already said, probably the biggest thing is, as Natalie was mentioning, there's quite a competitive nature to your undergraduate degrees. And once, you kind of move into this postgrad degree, realizing that you can learn so much by working with other people and trying to make the most of teamwork and team study, and importantly, not comparing yourself to others once you're now in that environment. I think something that all of us kind of go through is readjusting to what it's like to study this course, to be around people that have worked really, really hard to get to this spot, and also being like, oh, I didn't know that. I didn't know this random arbitrary fact that they probably memorized randomly. How does that reflect on me? And so really just trying to focus on, what is the bigger picture here? What am I working towards? I'm trying to learn how to be a doctor so I can look after my patients in the future. It's okay if I don't know this one little fact right now. I can go off and learn that if I want to. But yeah, kind of having that mindset shift and being kind to yourself for the long run so that you don't get burnt out as well.
Yeah, very true.
Yeah, I love that. It's very true.
So I guess just going down the list of the next question, how does a typical day in med compare to undergrad, particularly doing a UniMelb undergrad? Do you feel as though it is more rewarding as you are learning more so for yourself as opposed to a grade? I guess we've covered this a bit already. Especially, I think, yes, for sure, especially since it's now pass fail, there's much more of an emphasis on learning enough so you can be a competent and safe doctor rather than trying to just be at the top of the cohort. Like Maddie said as well, and sort of Veronica just then as well, like, don't worry so much. And this is totally different to undergrad too. I don't worry as much anymore that I don't know. I try not to worry that I don't know as much as my peers or as much as I think I should know. Because at the end of the day, there's so much information, and let's be honest, like, you're going to forget a lot of it by the time you reach internship. And everything that's really important, you'll probably have retained, and you just won't know it until you get there. And once you are an intern, the things that are important, will be drilled into you. Like, you know, if you just think back on any job you've done in the past, like medicine is once again a job. Think of any job you've done in the past, you're probably really stressed. You know, you didn't know how to do something at first, and then you just did it a bunch, and over like 2 weeks, you probably were really good at it. Like, you know, medicine's a little bit more complex, but at the end of the day, it's the very same thing. So yeah, that's sort of how it is. And a typical day in med, well, maybe Maddie, Natalie, or Veronica can cover that. It sort of depends on the year level, but we can cover that in a bit. Does anyone else have an answer to that question?
I guess typical day for me, and I think it's definitely when you're in MD2, you're trying to get this balance between like you're studying at home versus like being at the hospital and doing placement and stuff. And Royal Melbourne is quite like, they want you at the hospital quite a lot. So usually it is like most days it's like pretty much a full day at the hospital doing placement. It depends on the rotation that you're on. But you know, it's pretty cool. Like I'm on surgery at the moment, so you go in, you do the ward round with the team. You know, today I presented a sort of case to a doctor and then did some teaching, and then went to surgery for a few hours, and then I had a few shoots in the afternoon that are sort of at the hospital. One of them was like at the bedside with another surgeon. Another one was like in an actual like lecture hall, so a little bit more like what you guys would be used to. Yeah, like, and then so that was probably started at 7 and I was home at 5, but I mean that's like a long day. Not every day would be like that. But yeah, I feel like there is a bit of a balance. Yeah, as I said, MD2 has been for me like a big shift. Like you being in the hospital, and the hospital is quite like an intense place, obviously. But yeah, it's usually a bit of a balance between normal sort of study, lectures, all that sort of stuff, and then like learning on the wards and being with the team and stuff.
Probably the further that you get through the course, the more different your day is to your undergrad life. So kind of MD1, you've talked about that kind of preclinical. MD2 now, what Maddie's in is you have like your surge, your ED, your med rotations, and you're still trying to learn a lot of the content. Then MD3, which George and I are in, it's quite variable. But today, so I'm on my psych rotation. I spent most of the day driving around to various patient homes and performing in-home assessments with the psychiatric team, kind of doing patient outreach and community support for people in need. That's also very different to our long days of women's and pediatrics, where there's much more of a focus of practical components and being with patients rather than that kind of study. And then in 4th year, you're really just trying to become an intern ready. And you just spend so much time on the wards, really doing a lot of administrative stuff so that you're good and competent for your first year out. And you've kind of learnt so much of the content over the previous years. Now it's just rehashing, and you spend less time with your textbook, more time with patients and with the other doctors.
Just to highlight how different everyone's day looks, that was Veronica's day. My day was just chatting with some of the other doctors in the office, and then they sent me home at like 1 p.m. because nothing was happening. Just to highlight what it can look like. Yeah, it can really vary. I guess if Natalie wants to quickly, she's talked a bit about it, but just how MD1 looks like, I guess that's the most similar to undergrad.
Yeah, so like Veronica said, it definitely is the most similar to undergrad. So at the moment, since Melbourne Uni is shifting to increased flexibility in the course, they've changed all the lectures to be online. So they do have a guide of week to week what lectures they want you to complete, but you can do it at any time. So how it will start is Monday, you have we call it CSL, case supported learning. You'll go in, you'll see your case for the week, say what you think it is. Then through the week, by yourself, you'll look at the lectures. The hours of lectures can range, it's usually about 7 hours a week of lecture content, lecture recordings. Through that, we'll also have live Zoom webinars or workshops, which can be microbiology, immunology, pathology, which is again usually case-based. Then we have 2 in-person classes in the middle of the week, which is based on practical clinical skills and your exams and interview and history taking. And then at the end of the week, you'll recap that week's case with an in-person class. And then every second week, we also have an anatomy lab where we go into the anat lab and work with pro sections from cadavers based on the anatomy work that we've been doing at the moment. On top of that, we have our placement every Thursday. So once a month, we'll be in your hospital. And that's depending on the clinical school that you're at. Some of it is with the patient and at the bedside. Some of it is more kind of hospital skills, like reading x-rays, ECGs with the doctors. And also practical bedside things like doing blood sugars, dipstick tests, etc. And then also you'll have a GP that you'll go to every fortnight, and shadowing them and helping them out as much as you can. So it definitely is that bridge from that undergrad style of class-based learning to clinical school-based learning.
I actually also quickly forgot to mention in MD3, and I forgot to talk about this earlier. This is to do with research throughout medicine. In third year, we do an MD research project. And essentially what that means is every Monday for basically the whole year, well, the first half of the year, we kind of do stats. We kind of look at essentially what is biostats, I guess you could say, like, confidence intervals, p-values, all that fun stuff. It's very similar to undergrad if your undergrad sort of has something like that. And then the second half of the year, you sort of get paired up with a supervisor, and you'll conduct like sort of a systematic, not a full systematic review, like a narrative review. It's like a shortened systematic review, or you do like a data analysis or something like that. And it's sort of meant to be a, dipping your toe into the real research world. And it's done every Monday for that sort of second half of the year. And at the end, you need to have a full write-up, and you do an oral presentation as well. And I don't speak for everyone, but I've heard of some students, they sort of go on and maybe continue that project with their supervisor after it's done. They might get a publication, they might not, but that's sort of not the emphasis. And yeah, I agree with what Maddie said. You don't really need to do research outside of, that's obviously compulsory, but you don't need to do research outside of med. It's already super busy. And if you're interested, go for it. But, it's part of the degree anyway, so I wouldn't stress too much.
I don't know if this was already mentioned, but a lot of the specialty programs will only look at papers published within the most recent 5 years of when you apply. So probably even if you are trying to pump out research articles in your first few years of med school, they're not really going to count towards that. So yeah, that's just something to keep in mind.
I might just switch a few slides ahead. There's just a few prompts if people need some thoughts about what to ask.
Yeah. Also, just this question about, is there much in the way of mentoring throughout the MD? I feel like that's also a really good question. At Royal Melbourne, they have this really lovely peer mentoring program where you just get paired, my group of 5 or whatever in our year are paired with the group of 5, the same group essentially in MD3 of 5 of them. Or I think maybe only 3 of them do it. But anyway, we have catch-ups with them like all the time, and they've been like really great in terms of just like providing support, and like we present patients to them, and they run little tutes with us and little, you know, bedside exam stuff. And it's really nice having mentoring from someone who's actually quite close in age, like, you know, close in the MD to you, because they remember exactly like where you're at, and they know how to pitch things to like your level. So yeah, I would say there is quite a lot in the way of mentoring. I've, you know, felt quite supported, and I feel like in medicine in general, there's very much like this great like teaching culture. Like everyone's really like teaching the sort of level below. Like, you know, we get even just a lot of teaching with like interns, and then interns get taught a lot by like the registrars, and the registrars obviously being taught by, you know, the consultants. And it's yeah, it's a really great sort of culture like that. I don't know if anyone else has got anything to add there, but yeah.
Yeah, there's a lot of levels of mentoring, peer mentoring within the program, as well as within the clinical school. We also have like a peer mentor program where one of our classes, so 10 of us, has 2 or 3 people who are older, so anywhere from MD2 to 4, and that's kind of informal, and we can catch up as often as we like and ask whatever questions we want. That's on top of the student society organizers peer tutoring. So it really is kind of more academic mentoring, but because those people who are older have signed up to help the younger years, they're also always super open and friendly to just general mentoring as well. So at the moment, I've probably got at least 7 or so people from all different clinical schools that I can just like message or chat to if I ever need any advice or help from anything, just from like, oh, it's my first day at Western Clinical School, what are the lunch options, to like, this content is really hard, I don't know how to approach it. So there's a lot of official channels, as well as kind of those unofficial things that you can form by going to the social society events and kind of meeting people there as well. So there's definitely heaps at Melbourne.
Does anyone else, I don't know if anyone else has anything else to add. There's this question here about anatomy, which makes me laugh because my anatomy is so bad. I don't think you need to do an anatomy course before med.
No, there's no prerequisites now as well. So they've taken away all the prerequisites as well. So there's people who come from fine arts or music or commerce who don't know anything. It definitely makes the workload easier when you get to anatomy if you already know it. But like, that's the same as anything. It's totally not compulsory to know it already, because they've taken away the prerequisites for a reason. So that's fine.
I mean, I also think anatomy is one of those things, like you can learn it all in MD1 and that's fine. But then like you get, I mean, I don't know if I speak for anyone else, but you get to MD2 and it's like, when am I actually going to use this now? And so it just like slips out of your brain anyway. I could do with an anatomy course right about now, to be honest. But yeah.
Yeah, you do a lot of anatomy in first year and then you don't really touch it again. Like it sort of pops up randomly when you least expect it, like in like this one question out of 100 in a test.
Or some like, doctor asks you some niche thing about like the layers of the abdomen or something. Like,
I wouldn't do an anatomy course unless you really wanted to for whatever reason. But yeah, up to you.
I guess in surgery, like if you want to be, you know, if you're surgically inclined and stuff, you know, you do a lot of anatomy and, you know, diploma of anatomy and all that sort of stuff later.
Yeah, that's like 30K in your hex.
Really? Oh my God.
Yeah, so just wait for first year.
Oh, so maybe do the anatomy course.
The other thing to consider is you're not going to have tons of time to review all of anatomy during second, third, and fourth year. So if you're really doing it for like, I don't know, applications for internship or specialty, you're just going to forget it all again. Like, like if you really want to do a course for that reason, just do it later.
Yeah.
If you do want to do some passive anatomy study though, I can recommend the Netter's anatomy coloring book. Chuck on some Netflix, get the coloring book out, color in a skull, and eventually you'll learn what it is, and it's very passive. So that's something you can do when you're not studying for the GAMSAT.
There's a question here on working during the course. If so, how did you manage it, or is it something not feasible to maintain? So correct me if I'm wrong, but by work, I'm hoping you mean sort of job, money sort of thing outside of medicine. Does anyone here have any strong feelings about this?
I've been working throughout the whole of med. I work for a radiology company doing like just medical admin in like an office essentially. Very easy to manage. I don't work more than like 6 hours a week. Some weeks I don't work at all. It's very feasible to work, and I think I wouldn't be able to like get by without like working a bit. Yeah, I mean, obviously, you know, some weekends I might work both Saturday and Sunday, and then you like go straight back into uni and it's like, oh, this sucks. But it's really is feasible. So I don't think you need to like drop everything and for med. I think, you know, and people might have different, you know, outlooks on this. It's obviously, again, like you've got a finite amount of time and you figure out what works for you. But I really think that like you can, you know, do uni through the week. You can work like one weekend day or even like one weekend night, and it's, yeah, perfectly fine.
In terms of working through the week, though, I guess it must be said, like I agree with
that's true, actually.
Don't stop things that you want to do outside of med. But yeah, I guess the thing with during the week, work hours can be a little bit unpredictable sometimes. Like sometimes you might finish from the hospital at like 1 p.m. Other days you might finish at like, I don't know, 6 p.m. because whatever you would do, you just sort of got caught up and you could leave and all that sort of things. So if you do have a job and you want to continue it or have to continue it, yeah, really try and get it on weekends.
Sorry, I should have said that. That's very true. Weekends.
Yeah, but it's definitely possible.
I work about 6 hours on weeknights, but mainly doing something like tutoring, which is quite flexible. So if you try and find something that works for you, that, you know, you can have last minute changes if something gets scheduled the day before, that's probably the best thing for weeknight work.
Mm-hmm.
Yeah. Again, same thing. Everyone I know in MD1 at the moment works. For MD1, they recommend no more than 10 hours, and I believe that the medical school recommends less than that, about 6 hours as you progress through the course. But yeah, the reality is you need money to live. So it's definitely possible. Most people do it.
What else is there here? With the clinical school setup, is there much contact between? Yeah, it's actually a bit sad. I feel like there isn't a lot of contact sometimes. I definitely feel like I see, you know, I've got my group of friends and we're all across different clinical schools and we all hang out regularly. But that's sort of outside the, you know, outside of the clinical school med sort of situation. But I think with clinical schools, you do end up seeing the people at your own one more often. And obviously there's like events and stuff that people go to and, you know, all that. But on the day-to-day, yeah, you end up seeing people from the same clinical school, I'd say.
Yeah, just to hit a few bits before I understand, I think another question asked, like if you preference, and you do preference, you preference like when you submit your application, and when you accept your application, I think you accept it on the basis that your clinical school, which you don't know the exact location of yet, will either be like one of the metro ones or one of sort of the rural ones. So you'll accept one of those two options. And then I think in like the first month or two of medical school, you find out what your clinical school is. They don't segregate you in first year, at least they didn't when I was first year.
No.
Second year is a bit more like you stick with your clinical school group. They do sort of have a bit of like a few events here and there where you mix, but more like social stuff, I guess. In third year though, you kind of move around a lot, like, and you do mix with people who aren't in your base clinical school. And then in fourth year, I think, as you know, as far as I know, you're back with your main clinical school group at your main hospital. So it varies a bit, but I guess in third year, there's a bit of mixing. But yeah, kind of like Maddie said, there's not tons outside of first and third year.
But yeah, there are like those formal organized events by the student society, like the ball, everyone goes. We have like pub crawls, scrub runs, a whole bunch of events where you can interact. But the reality is you'll probably make friends in first year from a bunch of clinical schools and see them as you go through.
Yeah.
The next question is about course structure and assessment. I can probably speak to MD1, which again has changed recently with the redesign. So we study in blocks. So we'll have like a cardiovascular block, resp block, gastrointestinal, and then every semester we have an assessment called a CAT, a cumulative achievement test. You get a grade, but overall it's just pass fail. So on your transcript they don't put your final grade for MD1, and they're pretty sure all the other years as well in the future it'll just be pass fail. At the end of the year we have an OSCE for taking a history and doing a basic exam, which we practice every week. We also have what's called situational judgment tests twice a year, which is basically just like making sure you're not a bad person. It's just like a multiple choice test to check that you're not going to like break patient confidentiality or something. And then we also have super mini assessments that are basically just like hurdles throughout the year. Little bits of writing that we have to do on like professional behavior, on First Nations health, on reflective learning, as well as some little hurdle practical assessments where we get your peers, someone from placement or one of your tutors just to watch you do something practical like an exam or a history and check off that you're progressing. So MD1, it's very just like lots of little assessments all the time, which I know is a big change from how it was in previous years. Not sure what it's like in future years. Maybe do you guys want to speak to like structure and assessment?
Yeah, MD2 is the same. It's again, probably even more so a lot of like those little assessments that are more like hurdles, making sure you're on the right track. Like, as I said before, it's all about like just making sure you're progressing at the right pace and that you're going to be a safe and competent doctor. So you do a lot of those, like they're called mini CXs, and they're just like little, you know, you do a little exam or a history with a patient in front of a doctor, and they just like literally just see it, like, you know, look at what you do. They give you some feedback. It's like quite, like it's honestly like quite useful. Other than that, yeah, OSCEs, the CATs, which is just like the, you know, multiple choice things as well. Short answer exam at the end. In MD2, I don't know if they're still going to do this going forward. I think they will. You do the long case, which is essentially like a big, bane of my existence, but a big like history and exam, essentially like a long history and exam of a patient, and then you sort of present it to a couple of assessors. And it's sort of like overall like a 25-minute sort of presentation with questions and stuff. Anyway, so that's a big part of the assessment in MD2 that you do a couple of those throughout the year. But yeah, other than that, it really is just those like sort of hurdle type assessments. And a lot of it is clinically focused, not so much like, you know, the sort of paper exams and stuff.
MD3 is much the same, with a few extra exams plotted through that. MD4, less so. Yeah, I think you have one exam that's kind of the same across all Victorian medical schools, just to kind of to standardize tests, just to make sure that you're intern ready. Plus, yeah, I don't know if there's like an SJT as well and stuff. I'm not very much across the year level above. But yeah, it's all quite the same.
The next question is sort of asking about elaborating on the relevancy of research after medicine and about specialty programs. So I think the first thing is just don't worry about this now. Like Veronica said, do this later. Enjoy medicine and yeah, just enjoy your life. Like I'm not even a go. Like I think it's very easy at that point. I think I was a bit like that, just trying to figure out what I should do early. But yeah, enjoy the ride firstly. I also think, and correct me if I'm wrong, a lot of programs are looking a lot less at research now than they used to. I think some of the surgery programs are a bit more, they look at it a bit more favorably. And obviously research is good, but just remember it comes at a cost. Like it will take up a lot of your time and you could be doing other things with that time. And sometimes they look more favorably on research that's actually relevant, and you don't really always know what will be relevant. And you know, you might think you want to do, I don't know, plastic surgery, but that will change like 100 times throughout your medical course, and you don't really want to lock yourself onto any intense research programs looking at something very specific just to find out a few years later that, like, you know, you don't actually need it, or they don't really give you that many, like, it sort of works on a point system. I think it's like, if you're an author, other than first author, you get like 1 point. If you're a first author, you get 2 points. If you have a PhD, you get like, I don't know, like 1 billion points or something. I can't remember. Like, it sort of works like that. But like, long story short, research is good, but there's a lot of people do it sort of in internship and residency. It's not something you need to do in medical school. And yeah, just, yeah, like, relax and enjoy medical school for what it is. If an opportunity presents itself, maybe go for it, but definitely weigh it up with how much you're enjoying your life, and, you know, how much you want to relax and do other things. And yeah, because there's always going to be other opportunities, and there'll be time for research too in the future. Does anyone have anything? Yeah, sorry.
Oh no, yeah, I reckon that's enough about research. Yeah. What else is there here? Maybe we'll go through tips for interview prep maybe after properly. I don't know if there's anything else here. Are there any cons of studying at Uni Melbourne where there is a bigger cohort? Maybe. I mean, I don't know. I think it's hard to know because you've only had the experience that you've had. You know, I'm at Melbourne Uni, which is a big uni, and then I'm also at Royal Melbourne, which is a huge freaking hospital. So, like, that's all I've really known. Like, you know, and I'm sure that there would be benefits of being in like a smaller cohort where things are maybe a little more, you know, definitely in a big hospital, you really have to put yourself out there to get, you know, experiences and opportunities because there are so many people and you can get swallowed up a bit. But I haven't found any issues with being with a big cohort. I think it's just, yeah, I don't know what the others think, but yeah.
Hard to know. Yeah.
It's difficult to tell. I mean, it's not, you're broken up into smaller groups, so you still get to know people individually. Like, your classes are in small groups of people. When you're in the clinical school, you work in smaller groups. So I think you still get that benefit there. But yeah, the large cohort also has some benefits as well because it's like a whole bunch of people with all different experiences to you. So yeah, I don't think there's really many cons that I've experienced. Maybe times Monday to Friday that we're typically doing uni.
Just depends on the day.
Yeah.
Depends on the
level as well.
Yeah, it depends on the year level. Yeah.
Yeah, so at the moment, my classes probably wouldn't go beyond 9 till 5:30, but I'm definitely not on campus 9 till 5:30 every day. Especially because the lectures are individual, do in your own time. But yeah, the actual contact hours are pretty reasonable. But yeah, I mean, some people stay on campus from like 8 a.m. to 8 p.m. every day in the library, which I think is a bit ridiculous. But yeah, it's pretty reasonable, the times. What else? Lots of interview questions.
Yeah.
Should we go through some interview advice now? Just to potentially finish up, unless there's anything else.
Yeah.
I don't know what to start with.
My
I guess
Oh,
go.
sorry. I was going to say my main tip is be ready for anything. Last year we had like some really random questions, quite abstract. So I would say for me, I think the most important thing to practice is just like stick to the minute mark, because it is digital. You don't get any leeway with going over. It just stops recording. And be ready for the most random things, like practice looking at a painting and just describing it, or like describing what a ball is. Like, not your classic interview questions. They'll definitely be there, but yeah, be ready for anything.
Have fun with the interview. I know that's super cliche, but like it helps. Don't get too caught up. And like with the descriptions, like that's actually a very common sort of thing Melbourne Uni likes to do, like describing abstract things, or like, you know, how would you describe the like a color without saying the color itself? It's not so much there's a correct answer. Just always remember that, like with some questions there might be, but with a lot of these sort of abstract ones there isn't. They just want to see that you can think on the spot and just have an imaginative idea of how to do something. So just keep that in mind.
Also cover your kind of basic interview questions. So think about, you know, describe a time when you showed leadership, or you worked in a team, or you failed. How did you deal with that? Literally list every possible thing that, you know, they could ask, and think of a lived experience of that. What's really important to try and capture in your response is not just the situation, but what you learned from that situation and how that's going to impact your future practice in that same situation, or, you know, as a doctor or something like that. It's much more important to emphasize what you've learned rather than what you actually went through. I think that's called the STAR technique. And yeah, try and kind of reflect as much as you can on that, like that big question of why medicine. The classic advice that everyone gives is try not to just say like, because I want to help people, but, you know, in the end, it's up to you how you answer that question. Reflect on it, see where your motivation lies, learn about yourself, and try and portray that kind of journey of you understanding that as well, if you can.
Yeah, I agree with all of that. The other thing I think that helped me a lot, and I just think makes, when I've listened to them in like the mock MMI and stuff, is just good structure. So just like at the beginning, you know, have some sort of structure, whether that's like, you know, I might like describe, you know, what I would do here in chronological order, and then, you know, how I would do it next time, or what I learned from it, or even just flagging that at the beginning, or being like, okay, I'm going to address this situation by addressing all of the people involved. First, I'm going to talk about so-and-so, and then go. It just shows that you're going somewhere with your response rather than like fluffing around, which I think, you know, can happen. And also in an interview that's very like, you know, very short time frame, you just really want to get like your main points out, and try and communicate in a way that's like concise, gets your point across. So I think, yeah, structure is a big one.
Just practice with friends as much as you can, and yeah, try and stick to those 1 minute responses, because 1 minute's really fast, and if you don't sort of practice to 1 minute, it'll surprise you in the real thing.
George and I did a lot of practice in undergrad together.
That was the best time.
Yeah, we did all of our interview study together, which was nice. It's, yeah, you get really good practice just by doing it with your friends. You give each other honest feedback. You learn a lot about each other, and yeah, learning what 1 minute feels like when you speak it as well. It's a good thing. Yeah.
I think that was most of our questions. It's getting a bit late, so we might wrap it up. But yeah, like, I guess feel free to contact any of us with any other questions you have. I think you can just find us on the Facebook event. Was there anything we wanted to add, or anything I missed?
I think that's about it.
Thanks for coming, guys. It's really great. Hopefully it was helpful to some degree. And best of luck with any future like GAMSAT study interviews. I'm sure you'll all be absolutely fine. Just remember, it is a process. And yeah, be easy on yourself.
Good luck, guys.
Look after yourselves.
Okay, bye, guys.
Yeah, bye.